So in the remedy differentiation or mathematics of remedy, interesting remedy anthracinum we have used but very rarely, especially for skin boils. First keynote of this remedy, then very beautiful understanding at mental plane of anthracinum. We will connect with the physical complaints. Anthracinum particularly useful for carbuncles, malignant ulcers, and complaints with ulceration, swelling, and intolerable burning. Mark the words carbuncle. Okay, carbuncle is a thing which will not heal very easily, especially in diabetics. Malignant ulcers. What is malignant ulcer? Ulcer, either in malignancy, associated with malignancy, is malignant ulcer, or any ulcer which is becoming rotten, incurable, stinking, and showing no signs of healing is a malignant, and deep ulcer. We define that ulcer is a malignant. ठीक है? Intolerable burning is important in anthracinum. Arsenicum or the best selected remedy fails to relieve the burning pain of carbuncle or malignant ulceration. When arsenic or any other remedy, they fail to relieve the burning pain of carbuncle, then try to think of anthracinum. Anywhere there is burning, arsenic and anthracinum should come into the mind. Along with that, hemorrhages, and there is oozing of blood. The blood will ooze. It will ooze. Black, thick, tar-like, rapidly decomposing. The blood will be black. Remember, this word black is very, very important. And tar-like. बिल्कुल डामर जैसा, बिल्कुल blackish. And the word blackish is important for anthracinum. This black explains the whole anthracinum. Septic fever, rapid loss of strength, sinking pulse, delirium and fainting. So this boil or carbuncle will go into a state of sepsis. Local symptoms will go into septicemia and leading to delirium and fainting. You can compare this situation to pyrogen, but pyrogen has a different existential problem. So my existence is not my existence is linked to some other person, even to some object, even to some pet. So there is the problem of linkage of existence in pyrogen, not here in anthracinum. Gangrenous ulcers, malignant type. Okay, so this is important. Felon, the worst cases with swelling and terrible burning pain. Even a boil becomes terribly painful, very painful with swelling, and the case, it becomes so deep in a short time. The boil goes so deep that even it can cause osteomyelitis, even it can cause septicemia, even it can cause septic arthritis. That is the malignant boil or malignant ulcer of anthracinum. Malignant pustules, black or blue blisters, often fatal in 24 or 48 hours. Okay, so you can judge the severity and the time pace. A small eruption, 24 to 48 hours, becomes so much destructive. Cerebral hemorrhages, symmetrical. Only remedy is anthracinum. when there are cerebral hemorrhages, and that too are very much symmetrical in CT scan, think of anthracynum.
Can be given in a acute case already?
Yes, definitely. We have to prescribe like this. On the pathological reports, when nothing is available, pathological reports, and if pathological report says, and if you see like this is PQRS, this is important. So all the remedies which are very fastidious, very symmetrical, think of those remedies. But in cerebral hemorrhage, symmetrical is only anthracynum. Styes in crops, anthracynum. In crops, if you see stye on the eyelids, anthracynum plus one remedy. Boils on the septum, nasal septum, boil is anthracynum, single remedy. Abscess of lip. We have not seen abscess of lip anywhere. On the lip there is an abscess. So this is anthracynum. Cancer of submaxillary gland, anthracynum, plus 4 remedy. Eruption pustule, lips black. On the lips there is a pustule, and that too it is black. Bleeding continuous, does not coagulate, is anthracynum. Continuous bleeding. Eruption, knees, blebs, anthracynum. Pustules black is anthracynum. Remember this word black. Phalon malignant burning, anthracynum. Fracture legs bones, tibia open fracture, anthracynum. Open fracture of tibia is anthracynum. Ulcers leg gangrenous, anthracynum. So it can go into gangrene also. Discoloration bluish accompanied by burning pain on the skin. Bluish discoloration with burning pain is anthracynum. Carbuncle with foul smelling. Eczema with burning. Sir, severe burning होती है, खुजली, जलन, anthracynum. Pustules black tip. Pustules with black tips. So black tips of the pustule is important. Abscess of internal organs. When there is abscess of the internal organs, anthracynum. Yes, internal organs, everything. Diabetes accompanied by boil. Think of anthracynum. Patient having diabetes, recurrent boils, think of anthracynum, especially black. Severe gas poisoning. Usually we don't get such severe gas poisoning cases, but it is a remedy, anthracynum. Severe gas poisoning means what? Severe gas is a mixture of obnoxious gases. कोई इसमें जाते हैं गटर में and then they smell it and then they fall ill. इसका मतलब क्या है? एंथ्रेसिनम ऐसे एनवायरनमेंट में नहीं रह सकता जहाँ पे इतना ऑब्नॉक्शियस एनवायरनमेंट हो, वहाँ ये नहीं रह सकता. इसका मीनिंग ये है, इससे अपने को ये समझना है. यस. सो व्हाट इज द कॉन्फ्लिक्ट ऑफ एंथ्रेसिनम इज इमोशनल एब्सेस. ठीक है. अब ये इमोशनल एब्सेस ये किस तरह से रखता है, दिस इज द ब्यूटी ऑफ एंथ्रेसिनम विच वी शुड अप्रिशिएट. And how that this proving was done, how beautiful they have analyzed the mind of anthracynum, it is worth appreciating. Abscess that has been formed out of very painful emotional experience. इतना painful emotional experience है, और वो what is abscess? Abscess is something which is localized. That emotional pain जो है, it has been concentrated on one point and has become an abscess. That is anthracynum. There is no anger here. Very important thing. Because usually in boils or abscess, we hunt for anger. There is no anger here. This is very important thing.
Emotional hurt is
Yes, so what is hurt? That grief and sadness, which is the pus, which is equivalent to the pus, which is being accumulated in the system. Okay? So we have to compare with Natramure in this aspect. So like Natramure, this remedy retains so much deeply hidden grief that one might consider it to be major remedy for silent suffering, equivalent to Natramure with respect to silent suffering. The dark emotional wound is buried deep in the psyche. It is as though all the emotional and mental suffering of anthracynum patient has been enclosed in one big blackish boil. Everything localized in one black boil is anthracynum. Unlike Natramure, anthracynum patient does not seem to realize this suffering. This is important. Now we have to differentiate these two remedy, natrum and anthracynum. Anthracynum does not understand that he is suffering from inside, whereas Natramure knows and he wants to suffer. He has decided that I will think and I will suffer. So here in anthracynum there is a state of resignation. He has totally resigned and he has kept it and cremated and buried deep into his psyche. He feels that this is how I have to live. This is the natural state of being. I have to live like this. This is how I will live my life. And will never talk to anyone else about it. अंदर दब गया, दफन हो गया, and this is all.
उसने खुद ने दफन कर दिया।
Yes, this is the autoimmunity.
यही मेरी नियति है।
Yes, this is my being. This is how I should survive. ये इसका adaptation है. So this remedy seems to restrict the individual's free expression of emotions. So the free expression of emotions are restricted. The more you keep emotions inside, the more you are bound to suffer. Okay. You keep things inside, you will suffer. One patient says nothing for years on end about a traumatic event that has experienced in the past. क्या हुआ साहब? हुआ होगा कुछ छोटी मोटी बात हुई होगी, वो एक ऊपर का एक्सप्रेशन है, बट डीप डाउन वो इवेंट जो है उसके लिए इज नॉट लेस देन अ बॉम्ब ब्लास्ट, उसका लाइफ का एक बॉम्ब ब्लास्ट, बट उसने उस इंसिडेंस को अंदर सप्रेस कर दिया है. ही हैज केप्ट इट डाउन. इंपॉर्टेंट थिंग इज उसकी मेमोरी भी खत्म हो गई है. उसने इतना सप्रेस कर दिया है दैट the memory of that incident has gone. The memory also has been suppressed. It is also buried. So in spite of the emotional trauma, he hardly is able to remember what has happened and what impact this incident has done on my health. वो भी उसको समझ नहीं आ रहा है. So this is a state of confusion. सो इम्पोर्टेंट क्या है कि कोई इवेंट हुआ, कॉन्शियस माइंड में वो इवेंट रजिस्टर नहीं हुआ, डायरेक्टली अनकॉन्शियस माइंड में या सब कॉन्शियस माइंड में चला गया. ओके, सो देर इज नो रोल ऑफ द कॉन्शियस माइंड इन बिटवीन. डायरेक्टली फ्रॉम द प्रेजेंट टू द सबकॉन्शियस वहां जाके रजिस्टर हो गया. बीच में उसकी कोई मेमोरी नहीं है. मतलब जो मेमोरी सेंटर है ब्रेन का वो इसमें इन्वॉल्व ही नहीं हुआ, इमोशन इन्वॉल्व ही नहीं हुए, डायरेक्टली वो सबकॉन्शियस प्लेन में चला गया. लेकिन इट इज डूइंग एन इम्पैक्ट. इट इज डूइंग एन इम्पैक्ट. सो consequence of such a grievous experience is an eventual withering of the psyche. It is as if a senility of the emotional level were produced in which youthfulness and joy are lost and subsequently replaced with inexpressiveness. So very good statement. Now appreciate it how they have understood. If such patient comes to you, he will never express. How they have understood this anthracinum, what observation they have done, God knows. But they have written this literature for us. So there is withering of the psyche is important. The psyche is getting withered. It is a senility of emotional level. So emotions जो हैं वो dead हो गए हैं अंदर से. But still that youthfulness, that expression of emotion is totally lost. So here what is replaced is being a robot. An inexpressive machine or inexpressive person or like a robot. Patient is like that. Not able to feel or express or to share deep emotion. So the existence is in a state of confusion. तो यहाँ एक confusion वाली state में व्यक्ति जी रहा है. He is not able to know what to tell, what not to tell. ठीक है. नेट्रम्यूर में कोई confusion नहीं है. He is very much clear that I am hurt. I have a grief. I am sad from inside. He knows. But the beauty of anthracinum is he does not know that I am sad from inside. This differentiate natrum and anthracinum. So there is withholding of emotion as well as the hurt is being kept and it is being insisted. उसमें एक बहुत हार्ड कवरिंग, जैसे जो स्पोर्स होते हैं ना, स्पोर्स दे बिकम एक्टिव व्हेन द सूटेबल एनवायरनमेंट कम्स. इट इज जस्ट लाइक द इमोशंस आर स्टोर्ड जस्ट लाइक अ स्पोर. उसके अंदर तो सब कुछ है बट आउटसाइड जो है एनवायरनमेंट उसको महसूस ही नहीं होता है कि दिस इमोशन नीड्स टू बी रिमूव्ड फ्रॉम द सिस्टम. उसको वो सेंस ही नहीं है. There is an apparent state of confusion. So the patient will cry sometimes without any reason. He will not understand because there is a state of confusion here. They will never tell that they had experienced such a traumatic event or situation in the life. So that grief they were overwhelmed with, they will not be able to express it. तो हिस्ट्री में नहीं मिलेगा कुछ भी. That is for sure. There will not be any data you will get. So this confusion compromised the memory of grief. So what is the grief? The grief of anthracinum is the death of loved ones, parents or friends in general. So the trauma is the death. And there is grief, and that too silent grief. 1 plus 3 remedy. Out of that, total 4 remedy. Ailment from grief, silent grief. 1 is anthracinum and 3 other remedies. ठीक है. So silent grief, silence, complete. No hush fush, nothing. There is only silence. Anger menses before anthracinum. Delirium, sepsis from. What is this sepsis? Is losing somebody is sepsis. And the grief which is being accumulated, this is sepsis for anthracinum. So blackness of mind due to accumulated grief plus blackness of the pathology equal to anthracinum. This is the mathematics of anthracinum. Black mind, black body is anthracinum. Accumulated grief is abscess equal to anthracene. So they will not give history. So on looking anything blackish with pus and non-healing thing, skin directly on the skin or anywhere, directly ask about grief to the attendants. They will tell कि साहब इसके तो ऐसा हो गया था. वो पेशेंट इन अ स्टेट ऑफ कंफ्यूजन, हाँ हूँ, तो वो एक कंफ्यूजन वाली स्टेट में ही रहेगा. तो अटेंडेंट्स विल गिव हिस्ट्री इन केस ऑफ एंथ्रेसिस. सो फर्स्ट फिजिकल कंप्लेन से ही आप एंथ्रेसिनम को अप्रोच कर पाओगे, बिकॉज द मेंटल कोर इज वेरी हार्ड टू क्रैक.
उसको याद नहीं है,
पेशेंट को ही याद नहीं है.
उसने तो अपने आप को एडजस्ट कर लिया ना, बिल्कुल भूल चुकी हूँ मैं उस चीज को, भूल चुकी हूँ मैं, बस आगे बढ़ना है.
स्टॉप कर देंगे.
स्टॉप.